Reporters for Vice News travel the world, putting a human face to the world's most important stories.
There's a solid wall of riot police officers.
But now, we introduce you to them.
They're doing CPR on one of the casualties here. We don't know if he's going to make it.
This is Field Notes, a show that sits down with our reporters to find out the stories behind their stories and how they got so close to the action.
Feeling pretty good about that?
In this episode, we talk to a team that set out to untangle the bureaucratic nightmare that's keeping an overlooked group, adults living with disabilities, from getting the care they desperately need.
Go!
Being mom to a 19-year-old who is, for all intents and purposes, a 2 or 3-year-old is all of the issues that you have with a 2 or 3-year-old, except for you can't pick them up on your hip and walk away when there's a behavior.
Push. Help, please.
What are you trying to get for Tennille right now? What kind of care are you trying to get for her?
Anything. We've got nothing. The system is so broken, I don't know that they can fix it. I think they need to throw it away.
Mina, Scott, thank you guys for joining me, and thank you for this piece. It is a deep dive into a subject that doesn't get a lot of coverage at a national level, but is very deep and speaks to a lot about how governments take care of their people, how we prioritize caring for the most vulnerable and needy. So first of all, thank you. It's a really stunning and moving story. Mina, I'll start with you. Can you describe the story? What is it that you were looking into, why, and what'd you find?
Sure, so really all credit to Scott. This is Scott's baby. He has been working on this story for a year, but essentially the piece is about how families with adult children with intellectual and developmental disabilities are navigating the landscape of care. And specifically, we focused on families in Pennsylvania. That's not to say this issue isn't happening all over the country. The characters that Scott, really spent the time speaking with were in Pennsylvania, and they have, a situation where they have an evolving sort of process for this kind of care. So that's why we chose to focus there. And so we went and met with 3 families who have children of varying ages, from 19 to I think about 30, mid-30s. And each child that we met with had, a very different type of situation. And so we wanted to speak with them and their families about what they had experienced, what options of care had been accessible to them, and sort of the challenges that they had met navigating this system.
Mm-hmm. Now tell me, Scott, about that landscape of care that you're talking about. What are people entitled to in states like Pennsylvania? How do they access it? And what are the problems? Why can't people get what they should?
Sure. So what a lot of people are looking for is home and community-based services for their child. So what will happen is they ask for services from the state, and you have institutions or you have home and community-based services, and there's a waiver. So they could choose to waive the institutional services in favor of that's known as HCBS services or HCBS. And the issue with that, though, is that it's a joint program between the states and the federal government to pay for home and community-based services and for the institutions. So there's only a certain amount of money that is allocated to these states, and the states only have a certain amount of waivers. So the caps, you'll have a cap very quickly, and that leaves a lot of people on what is known as a waiting list. So for example, in Pennsylvania, you have over 12,000 people who are on a who have intellectual or developmental disabilities who are on a waiting list for HCBS or home and community-based services. And around the country, that number is 590,000, almost 600,000 of individuals with developmental and intellectual disabilities who are waiting for services. And that is even broken down further. So in Pennsylvania, for example, you have over 5,000 people who are considered emergency need. What that means is that they need help now or within the next 6 months. Mm-hmm. And when you ask the government of Pennsylvania and you say, well, does that mean they're going to get the services in 6 months? They say no. So it's almost an arbitrary label. It's more so a designation in terms of giving out the care than it is an actual plan to get them the care. So, you could linger on a waiting list for years and years and years in order to get some of these services. And what is the reason for that? It's money. And our country is just not willing to invest in these communities. And so I would say money is probably one of the biggest drivers of
it's
these
money,
things.
it's staffing, it's they don't have sometimes they don't have the nurse to send to your house, and that's because they don't have the workforce that's willing to stay in these jobs. And I mean, I think one thing we heard from a lot of these families and from sort of the industry at large is the salaries for these jobs are incredibly low. They're, someone said in the comments of this video, like, I can make more money at McDonald's than being a nurse. And, that was a nurse speaking, saying,
Wow.
like, it's really hard for me to go to my job knowing I could be making more money at McDonald's than I am doing this kind of care, which is incredibly physical. It's a full-time job. You're not able to take breaks really when you're doing that kind of job. It's demanding, it's emotional. And so a lot of it also is the workforce, that because these jobs are not prioritized, and I think, we did speak to the government of Pennsylvania and they acknowledged the same thing. It's until we can, as a country, change our perspective about what these jobs mean, then, until we get to that point, we're not going to be compensating these people, giving them the benefits that make this an appealing and attractive thing to do. So then you end up in a place where no one really wants to do these jobs. The people who end up in the jobs burn out quickly. They're not paid enough to stay, so you're getting high turnover.
Yeah.
All these things lead to this crisis of care where families are dealing with, being told we don't have care for you, getting care that, is someone who comes and then is someone different the next day, or, lots of turnover, things like that, where you can't really establish a standard of care if you're changing providers constantly. So it's a lot of factors, and a lot of it comes down to how these needs are prioritized,
Right.
Against other needs.
No, 600,000 people nearly that's a lot of people. And without the kind of home-based care that we're talking about, it's up to the parents of
Right.
these adult children
Right.
with severe developmental disabilities
And
to care for them.
siblings,
And
parents and siblings, yeah.
So talk to me about that, because I think, what I felt as a parent myself and as watching the piece is you love your kids so much, you want to take care of them, you want them to be taken care of. What was it like spending time with these parents? What were they asking for? I was struck by the tone of how you guys approached it. I just want to know more about how you put it together, because it's a deeply human story and something that was deeply told in a humane way, So take me through talking to these folks.
Yeah, I think the starting point with these families is nobody wants to send their child somewhere else. Like most families that we spoke with, they really care deeply about their children and they want to be able to take care of them as long as possible. And you get to a point as a parent where you can't do it by yourself. Whether that's, they're getting older. Many of these parents told us, I'm afraid I'm aging. I literally can't pick up my son if he's having a violent episode. I can't restrain him. Susan, in the piece, she told us, like, if my son is gonna run and throw himself in front of traffic, I can't stop him. And, those are fears that these parents have that they're not able to do enough. So when you start at that place, you realize like how far they've already come, that they're in this situation where they're needing this extra help and needing someone to come in. So someone like Tammy, she really doesn't want Tennille to live somewhere else yet, but she knows that down the line she might not be here forever and she has to have something lined up for her daughter. So we really just approached it, Scott had been talking to these families for a long time. We wanted to just come and meet them where they were, see what their daily lives were like, have them sort of take us through their routines, which was really emotional, moving to sort of see exactly what it entails. It's a full-time job, and these are adults who have full-time jobs as well. So Tammy is a nurse, right? She's a healthcare professional. She works in a hospital as well, or in a medical setting. So she has to go to work. She has to juggle going to work and caring for her daughter. Her daughter can't be left at home alone. So these are really big decisions that they're grappling with every day, and she's directly dealing with this crisis of staffing. So, she has been through a churn of different medical professionals like nurses, aides, and things like that, where they're just really not getting what they need. And it's, affecting them every day. So we wanted to go spend time with them in their different settings. I think Dr. Downey, who's a former professor, he is both an academic who has studied this field and a parent of a child with needs. So he was an interesting voice for us in talking about sort of the big picture landscape of why we're in this place and what the different choices are for families, as well as a parent who has had to make these choices for his sons.
Do you worry about Thomas being lonely here?
Every day of my life. Yeah. The issue of loneliness, isolation. You know, there's the real concern. Who will love my child? And my wife's instinct from the very beginning was, who will take care of him when we can't? So in some respects, being a parent of someone with a disability is no different than being a parent of someone who is more difficult. But in other ways, it's life-altering for everybody. Right, Tom? Thomas, you changed my life. And you did.
You know, I think in our team, Julia and Sam, our producer, and our DP who came with us to film this piece, I think they also really wanted to tell the story in an intimate, personal way. So just, being in Tom's bedroom with him, and as close as we could get to just spend, being with Tammy and Tennille in the morning when they were eating breakfast and just seeing what that's like. And, Tammy said it to us, I think it's in the piece, she said, you just met my daughter today, and I can see it in your eyes, and we don't want to be pitied, we just need help. And it's really hard for people who are not going through this situation to understand exactly what it entails, but these families are just really asking for what they are owed. They're not asking for anything extra, they're just asking for what the state has told them that they deserve, and is just having trouble meeting the need of actually getting them that care.
Which is what sort of makes, as a viewer watching the piece so infuriating, which is like you can see that people need help. You know that there are laws on the books that effectively say you get that help, but then it's the execution. Scott, this was the first time you've been in the field, I gather, and you've worked on this story for over a year. You've talked to these families on the phone. Take me through what it was like for you to, travel and meet people face to face.
I had a really wonderful time meeting the families and seeing Tammy's situation and Tennille's situation in person. Because there's a difference between hearing about it on the phone, and Tammy could tell you how difficult it is, versus going there and watching her struggle with trying to help Tennille put her shoes on. There's a total 180 between just hearing about that and seeing it. So that was definitely a really important aspect of the piece, is actually going out there and filming their day-to-day. I remember one of my earlier conversations with Tammy was exactly that. I said, we want to come and show just what a morning looks like. And even then, we're not going to be able to capture everything that happens. Like, for example, if they have a behavior or a meltdown, we weren't there for a behavior or meltdown for some of them. So we're not even capturing the full breadth of what they go through. We just captured a very small slice of it. But even that, I think, is super important to show.
Yeah. And, we were talking about this earlier, a lot of the stories that we do as a news organization are in far-flung corners of the world that maybe have conflict, that are these extreme zones. But there's something about an interiority of extreme that these are people living through, and they're doing it every day, and it's here in Pennsylvania, When reporting on a story like that, and I've had some experience with it myself, what is it like for you as a correspondent? Because you're talking to them, you're trying to be there. And I think one thing that I was struck by was how the rapport between you and the people you're talking to was strong. You were there to listen, and you were listening very intently. What was it like for you? You're a parent,
Yeah, I have 2 kids, and I think when you meet people and you meet them with their children, you can just sort of see their full, you understand it. It's not a perfect, rosy situation. Tammy and Tennille, in the morning, it was difficult. And I think I was really impressed by her willingness to just be really open with us and show us, this is what it's like. And it's not, it's not all just rosy, perfect, I'm having this inspiring life and, uplifting, inspirational people taking care of their children. I think she was just really real with us. And for me, I just wanted to kind of hang back and experience, what her life was like before asking her anything. So we spent like quite a bit of time with them before we even sat down to do the interview, and watched, everything from eating breakfast to, which are like little things you don't think about, right? Like she can't chew. So her mom is making all of these really special things for her to eat. It's just, like Tammy said, she makes all of their meals for the entire day, right? At 8 o'clock in the morning. So little things like that, you understand like how much thought is going into every aspect of this. She's taking her all over. She's built this kind of, animal wonderland for her daughter because her daughter can't go to the zoo because she might have a meltdown. She might not want to behave that day. She said her daughter likes to ride horses, but they could never get there on time for their appointment because, you can't predict what someone like Tennille is going to be feeling that day at 5 p.m. So she built this whole experience for her daughter. We spent a lot of time with them there to really see, what that's like. And we got to connect with Tennille, I thought was really special also. There were times, and that's not in the piece, but she would grab our hands and kind of try to communicate with us too. And we're there in her space, we're in her house.
Yeah.
And that was really, I think, important for us to make sure she was comfortable as well. Because it's a lot. You just show up with all your stuff and you're there for the whole day. And, she didn't ask us to be there. And so that was really powerful. So I think for me, I just wanted to kind of be there, experience it, and then just ask them the things that, I would be wondering about myself. So with Dr. Downey, with his son, it's so clear that it's a very difficult decision for a parent to put their child somewhere else and to only come and be able to see them, whatever it is. He's lucky, he gets to see his son very often, they live very close, but, I was really struck by the potential for loneliness, and that was the thing that I think all of the parents expressed to us. That's like a big fear. So, in asking him, are you worried about your child being lonely here? I think all of the parents said the same thing, that that's like their biggest fear is when they're gone, like what happens? And so just, kind of being there to ask the question that I would ask, if it was my child, I think I would be really worried about them being lonely. So just asking sort of questions that I would have had if that was my situation.
And so much about the work that we do is putting yourself in the shoes of someone else for a little while to understand what their day-to-day is like, what the landscape of the decisions and the things that are available to them are.
And to acknowledge that we really can't totally understand it,
Yeah.
And
then the other thing is like, and I think about this a lot, is just like, there's no good reason that like I'm me and another person's another person who's like, just, I don't know.
And each of these kids have tons of siblings, and that's the thing we didn't even get into in the piece. But Thomas has several siblings, and Tennille has several siblings, and those parents are also really worried about their siblings, and the impact that this has had on their other kids. And Tammy was saying to us, my other kids have never really had a normal childhood because I was always having to take care of Tennille, and so I would miss their Little League games, and now she doesn't want to burden them. They've been able to move and have houses elsewhere and other lives and their own kids. So that is another like huge part of the struggle is like, to your point, we have no idea like who's going to end up in what situation. And so a huge part for these parents in needing and seeking out this care is they also don't want to now put their other children in this exact same situation. So they really need the help to also, it's not just for their child, it's for the entire family to be able to sustain themselves.
It's the kind of situation that I think a lot of people, myself included, you try not to even think about it when you go about your life, right? Like, it's a nightmare scenario to have your child have to be completely dependent upon you and be developmentally disabled well into adulthood. But I think one thing to think about is like, these aren't immutable characteristics. Like, this could happen to anyone, to any child, to any person, and then that person would need this sort of care. So it's not a limited population that we can just put in one bucket. It's a possibility for all of us.
Yeah, and as soon as you do a story like this, you hear from everyone in your life who has somebody in this kind of situation. And so you realize how common it is to have someone in your circle of loved ones who is dealing with a situation like this. And so it's really not an isolated problem. It's not like a problem for someone else to figure out. It's something that really affects everybody.
And I think that might be the biggest issue here, which is that it's not really talked about. Like, this is not an issue that's given a lot of play at a national level. And if there is a bill in front of Congress at the moment, or it's being marked up or wherever it is right now, like, sounds like the kind of thing that could bring both sides together on something, right? Like, it's a jobs bill when you think about it. It's a basic care for each other bill.
And I think one thing that's kind of interesting about the pandemic is suddenly there is a lot more conversation about like money from the government and what we can do with it. So every time you talk to states about different issues, they're suddenly saying in the past year, well, we're going to get all this money from the government, and like maybe we'll put some of that into this. So I think it is changing people's mindsets around what is important, what's worth spending money on, you know, and maybe this is one of those places where, because there's new attention to it and because there is sort of this federal push to give states more money because they've had such a bad year, that maybe we'll see things like that start to change.
And it's questionable if it's even going to like, it will cost money up front, sure, but we don't acknowledge all the costs that come already in our society, right? For example, when Joey was in a group home and he wasn't getting the treatment he needed, if he eloped or escaped from the group home and the police were called, the cost of the police. Like, police in the instance of Joey, I believe, told the group home, we're not your behavioral program, meaning we're not part of your behavioral program and we're going to have to start charging you for this. So there are a lot of hidden costs in the system, whether it's a forced psychiatric, putting somebody into a psychiatric center. That's a cost, the court costs of that. All of this is hidden, but they're very real costs. We just don't acknowledge them. So even by saying, oh, we need to allot more funds to this, really what we're doing is just directing funds that are already being spent on services that aren't focused and directed and tailored to the individual, to being individually focused.
Right. Well, there's so much at play in this piece, and it was told with such, like, I don't know what the word is exactly, but I want to say love, but I don't know if that's too strong, but just empathy and like humanness. And I really, it's the kind of piece I'm like proud that we did together.
Oh.
You guys did it, but
Hey.
I'm happy to have this conversation today.
Thanks for giving it a space.